A 38-year-old woman is brought to the emergency department by police after being found wandering the streets, confused and disoriented. On evaluation, she has poor eye contact and gives vague answers. She believes her neighbors are spying on her through television, and the government is sending her messages through the radio. Her vital signs are stable. Her chart reveals a diagnosis of schizophrenia with multiple previous admissions. She has no known family support. She refuses medical care, stating, I do not need help, I just need to get home before they find me. The psychiatric team deems that she lacks insight and is at risk of to herself due to neglect. The attending physician decides to admit her involuntarily. What is the most appropriate next step in managing this patient ethically and legally? A. Restrain the patient and administer antipsychotic medication immediately. B. Discharge the patient with community follow-up, respecting her autonomy. C. Proceed with involuntary admission and notify the appropriate legal authority. D. Attempt to pursue the patient to stay voluntarily before considering involuntary admission. C. Contact her employer to inform them of her hospitalization. And here in this case, the correct answer is proceed with involuntary admission and notify the appropriate legal authority. The reason why option A is not the right answer is because restrain the patient and administer antipsychotic medication is not the right way to go for. It is not legally allowed until we have some emergency or some legal authority to do this. Discharge the patient with community follow-up respecting her autonomy. Patient does not have the insight right now about her condition. So if we allow her to go, it will be unsafe for her and for others as well. Attempt to pursue the patient to stay voluntarily before considering involuntary admission. Here, the same thing, patient is lacking insight and she will not be able to understand this. Contact her employer to inform them of her hospitalization is incorrect because this will be a breach in her confidentiality. So the correct answer is C.